Exercises for breast cancer survivors. Before breast cancer, you were everywhere, on top of things and running your life. But like many women, your diagnosis brought that to a screeching halt. Add in the effects of surgery, and you might feel like getting back to your old self is a lot harder than you imagined. That's why we feel starting an exercise routine with your doctor's go-ahead is great for both your physical and emotional health. So why should you consider getting serious about your post-surgical exercise? Well, regular exercisers have a lower risk of breast cancer recurrence, increased mobility after surgery, and overall better quality of life. As soon as a week after surgery, your doctor may suggest a stretching routine to combat the natural tightness in the area of your breast surgery. Likewise, if you've noticed extra pounds you've gained during breast cancer, know that 50 to 96% of women in your position experience weight gain and muscle loss. So you're definitely not alone. So we're here with 6 exercise suggestions to consider after surgery. But first, we'd like to thank our sponsor, the company who developed Breast Cancer Index, a test that may help women with ER-positive, early-stage breast cancer decide with their doctors whether to extend or end anti-estrogen therapy after 5 years. Right after treatment, it's important to avoid losing your range of motion. This means stretching the affected areas. Here are 2 of our favorite post-surgery stretches. Pendulum. Bend at the waist and let the affected arm dangle towards the floor. Make small circles with your hand until you feel your arm moving effortlessly. Do 10 circles clockwise, then counterclockwise. Make sure to repeat with the other arm as well. Chest stretch. Standing inside the door frame, raise your elbow to chest height and press against the frame. Lean forward until you feel a stretch and hold for 30 seconds. Do this 5 times, repeating with both arms. Also, keep in mind that tightness in your chest and armpit is normal. If you're having trouble with your stretches, try them again after a hot shower when your muscles are more relaxed. A few months after treatment means it's time to get your strength back. Weight training for your arms, chest, and back helps offset lymphedema while getting you back to your pre-treatment level of fitness. When you're comfortable, you can do these exercises with light weights, usually 1 to 2 pounds. Seated lateral raises. Holding your dumbbells, sit your back flat against a chair. Lift your arms to shoulder height in a wide arc, elbows bent. It should look like you're trying to fly. Now do 10 reps up and down with both arms at the same time. Seated bicep curls. Sit with your back flat against a chair with a weight in each hand. Your elbows should fall to the sides of your waist. Now, without moving your elbows from the side of your hips, raise each weight to your shoulder 1 at a time. Do this 10 times on each arm. Single arm row with lunge. Stand into a partial lunge with your right leg out in front, bent slightly. Then make sure to straighten your left leg behind you with your feet flat on the floor. Rest your right elbow onto your right thigh. Then with a weight in your left hand, pull it up to your waist. Make sure your chest stays facing the floor. Do 10 on one arm and then switch sides. Aerobic exercises like walking, jogging, and swimming burn calories and help you lose weight. Cardiovascular fitness not only sheds the extra pounds, but lowers your chance of recurrence as well. In fact, walking is the most widely recommended exercise after treatment. According to the American Cancer Society, 30 to 60 minutes of exercise at least 5 days a week is the proven amount to reduce the risk of cancer. But if you can't do this right away, don't worry. As with any exercise routine, the key is to start slowly and build up with time. With some of your old routines put on hold, we think it's important than ever to build new habits that will speed up recovery. Exercise can give you a sense of control while helping you pick up the pieces as a survivor. You might not be able to control your genetics or what's happened in the past, but you control how you feel about your body from this day onward. To get more practical tips for breast cancer patients, be sure to subscribe to Breast Cancer Answers here and leave your own questions in the comments below. We'll do our best to answer your questions in future videos. Finally, we'd like to thank our sponsor, the company who developed Breast Cancer Index. To find out more about your treatment options beyond year 5, just click the button and download our free list of 15 questions to go through with your doctor.